Hello and welcome. I am Dr. Anil Joshi. Welcome you to my series Learn Radiology with Dr. Anil Joshi. Today's topic is about radiophysics. By and large, radiophysics is always considered a bit complicated, or people think why I should know it. But once we start going through my series, you'll find that radiophysics is extremely simple. We have made it simplified ways. We have not made it complicated at all. And every time what we are emphasizing is how it is helpful to you. Why you should know it. What will happen if you don't know it, and what will happen if you know it. So after understanding of all these things, you will develop interest in physics, and you will start knowing what is the key relevance of all these things. The X-ray interacts with the tissues, and that determines image contrast. Now radiation dose and the diagnostic accuracy, all these things depend on interaction of X-ray with the matter, and if you have got sound knowledge of this, we can get minimum radiation dose, high diagnostic accuracy, and good contrast image. Now for that, what is the photoelectric effect? That gives you more contrast. Where you need more contrast, black and white, are either when you are imaging a bones or when you are dealing in angiography, there you need a high contrast. And third is mammography, where you need high contrast, and for that you use low kV and a different tube. Now for this you should also know what is a Compton, that is a more scattered than hazy images. And as far as safety is concerned, hazy images with low diagnostic yield we will not use. So we have to use either grade, collimate, or optimal kV help to manage these interactions. So once you know the interaction, what is going to happen, you know the preventive measures, you can apply it and get still good picture, because physics is physics. It cannot change for you, but you can modify it so that it can give you good images. Then unmodified, the what is also called Rayleigh scatter or a pure scatter will occur. Then photoelectric effect will cause the pure absorption, and Compton effect will cause scattered and absorption. So Compton effect here we are going to consider in this lecture. Remaining all matters are different. They are different. Here we have covered them, but in very short. But in other lectures we have covered it in more detail. Then the pair production or the pure absorption that can occur. So these are the things that can occur. Now what is the photoelectric effect? One after another we are going to consider them to learn interaction. Now complete absorption of X-ray photon by an inertial electron, most likely in the bone, dense tissues and calcifications, and that will not allow X-ray to cross, and they will not produce any effect on the film, and they will look white. Then the increased image contrast. What is the contrast? Is a distinguish between a black and white shades. So if you want to increase the contrast or high contrast, then you can go for this effect. But here you have to think that patient dose is also important. More prominent at the lower energies and with higher atomic numbers of the tissues. Then what is the Compton scatter? The photon interact with an outer shell electron and gets deflected with reduced energy, and that will occur mainly in soft tissues. Major causes of image degradation and occupational exposures. Though you will get more exposure, which is of no use, then image will not be of good quality, there will be more fog, so that you have to reduce. Now it is dominant at the energies above 60 kVs, more or less. Then what is coherent or Rayleigh scattered? The low energy interaction, no ionization, slight direction of change, minimal impact in a diagnostic image. So coherent scatter as well we need not consider. And pair production only occurs at high energy levels. So it is more important in radiation therapy. Now let's see here further the interaction. What is interaction is when an X-ray strikes an object, what happens is interaction. Now scattering, change in direction of a photon with and without loss of energy is a scattering. Then absorption, deposition of energy, that is removal of energy from the beam and it gets stopped. Then attenuation, reduction in intensity of the main X-ray beam caused by absorption and scattering ionization combined effect. So attenuation is something which we have to consider when we are producing different gray shades in images. And what is ionization? Ionization is a removal of electron from the natural atom producing a negative ion. So here we have shown you diagrammatically what happens when incoming X-ray photon is coming, then what happens first is photon completely scattered. Then what can happen? Photon totally absorbed. Photon scattered after some loss of energy, and that produces, depending on the loss of energy, gray shades of the image. And photon transmitted unchanged through and through, it will go and hit the film or your digital device. The electron, so what is the ionization? Is removal of electron from natural atom producing a negative ion, that is the electron, and a positive ion, that is the remaining atom. So these are the two effects of it. With the help of diagram you can understand it better. Hearing it may look a little complicated, but looking at a diagram it will be very, very simple. Now exactly what it happens is given in this diagram. Whatever we discussed just now is more elaborated only with the help of diagram. Now let's see what is in the diagram. The incident photon strikes an inner shell. A photon ceases to exist, then recoil and electron exits. Then vacancy is created, and this vacancy is filled by the electron of a higher shell. Has to be, na? The higher shell only can come inside. Now, emits characteristic radiation, predominates the low energy photons, and what is the result of it? That is the kinetic energy of recoil electron, the energy of incident photon minus the binding energy of the electron will be the kinetic energy of recoil electron. Now let's go further. The kinetic energy of recoil electron refers to the kinetic energy possessed by the electron after it has been struck by a photon and recoil. In the context of the Compton effect, the recoil consequence is the photon transmitting some of its energy and momentum. In a way, this process occurs. Now what is photoelectric absorption? Look at this. A X-ray has come, it has hit, and there is photoelectron, and that is a characteristic radiation. What it is in diagnostic radiography? Bones undergo more absorption than equal thickness of the soft tissues, contributing to the optimal density of the image. The X-ray photon absorbed by the patient are low energy, hence they are absorbed. High energy will pass, no scattered radiation, increased patient's exposure will result in it, because for getting good image you will have to give more and more X-rays, so that will give more exposures. Then if contrast agents are used like iodine or barium, then they emit characteristic radiation which is energetic to cross the patient and fog the film, and therefore useful in intensifying screens. Now we will come to Compton. The incident photon collides an outer shell, imparts energy from that electron. Then there is a recoil of the electron occurs. The photon is deflected. Energy of the scattered photon is equal to the energy of the incident photon minus some of the kinetic energy gained by recoil electron and its binding energy. Ultimately, it is all plus minus of the energy lost and energy gained by some of the other objects. Now we are given in comparison to just now all we had discussed in detail, first theoretical, then with each diagram. Now here just a comparative of the competent and photoelectric absorption. Two effects are. Now what is the coherent scattering? Look at this incident photon and it is getting scattered. They are of low energy because they are outside. Now low energy incident photon passes near the outer electron of the atom. This momentarily excitation at that same frequency, the photon ceases to exist. It disappears. Then existed electron remains to ground the site. Now generated another X-ray photon. So what will happen is conversion of one energy into another will result into the production of X-ray. But will they of the high energy, of the good energy, will they of the energy sufficient to cause the image? So that is all. If it is going to fog, then they will be of no use. Now look at this here. We are given differential chart. In a chart we have given you everything what we have discussed. Now electron affected in photoelectric effect, in Compton and in coherent. Then net effect or on atom, that we are given of 3. Then we are given what happens to a photon, what happens to electron, and what is the clinical significance of all these exercises. This we have going to get in detail here. And with that, we are coming to the end of this lecture. I try to make this topic very simplified with the help of some interesting diagram and some animations. I hope you have enjoyed it, you have followed it, and it was easy for you to understand. Charts are given for the comparative aspects so that in the one glance you can get what is the difference. Now I thank you for your kind attention. With this is Dr. Anil Joshi logging off. Till we meet next time, goodbye, good luck and take care. Don't forget, basics are important.